it's a pleasure to actually kick off our webinar. So I'm going to turn it over to Tina. Tina, if you would just start with an introduction, which I'm sure you already had planned, and then we are going to hear from her. So Tina, the floor is yours.
Okay, well, thank you guys. Thank you everyone for making the time today. And I'm really honored to be chatting with all of you. This is the part of my job that I really enjoy the most. And so, Isabella, thanks for the invitation. And I love my work with the Alzheimer's Association. Like all of you, I too benefit from funding and support from them for one of the studies I'm working on. But a little bit about who I am. So my day job is that I'm an assistant professor at NYU. I work in their School of Medicine and in their College of Nursing. I'm board certified as an adult and geriatric nurse practitioner. Older adults are my passion. And really my, main area of focus and work has to do with keeping people in their communities as long as possible. My goal, my work very much stems at the personal and professional level. My grandmother just turned 100 years old the other day. She attended her adult daycare center for 21 years. When I went to college, she had nothing to do all day because her job was to take care of me. And so she then is now in a nursing home because she broke her second hip. But man, she's sharper than all of us in this call. And super amazing. And I really credit so much of that to the extended kinship network that she had in her program. So it doesn't take a psychologist to figure out why I love geriatrics. My other grandmother, by the way, that's the baby grandma. My other grandma's 103. She lives at home. She is an incredible force of nature herself. And so, my whole goal in life, both personally and professionally, is to make sure that people age as well as they do, and are in the homes and places that they love the most as long as possible. And were it not for the fact that my mother had to care for my father, who passed away, who was very sick, we would have kept my grandmother at home much longer. So I understand what you all are doing because I've lived the experience of caregiving myself. I also see the impacts that home and community-based services have. I deeply understand the impact and need for respite services. And because I'm a researcher, my job is to not only look at these programs, evaluate them, understand how we can leverage them to improve health outcomes, but to really innovate in this space and to figure out, the reliance on home and community-based services is greater than ever, and it's not going away anytime soon. I don't think our legislation and the support for these programs has caught up. And I think there's just a broader feeling out there that just like family caregivers, I think that they're just always going to be around and they'll make it work because historically we've been so innovative in terms of workarounds and continuing to deliver services as best we can in spite of getting very few resources to do so. So I will say that I've been studying, my largest area of my focus is adult day services. You can understand why. I've seen firsthand their impact. So I know there's a few of you on the call who run adult day programs. I also work in home care as well. But I really want to talk to you guys today about my experience working as a researcher in this field. My research is particularly uses a community engaged lens. So I don't just design research projects for home and community-based providers to implement. I design them with them. We design them together. I am the person who has the fun job of coming in and taking a 360-degree view of what's going on, asking a lot of questions, and working with my colleagues who do the impossible and wonderful, beautiful work on the ground of caring for these people and working together to think through challenges and opportunities in ways that are sustainable. So if I could, I would spend the whole hour complaining about the lack of funding and support for these vital resources. But, my goal is for the world to understand that things like adult day services and respite programs, these aren't dancing in dominoes. These aren't caregivers going to the beach while someone else does this work. These are lifelines. These day programs, in my opinion, are incredible sources of, platforms for chronic disease management and social engagement and connection, which is something we all need. And I've spent much of my career trying to understand how we measure that, how we look to that, how we tell the story, and how we continually innovate in these spaces to make programs better for families and also more sustainable. So what I was asked to talk to you guys today about, and I'm super excited because it's so much at the center of what I do, is how we work together, but also how we make programs and projects that are actually sustainable beyond a grant period, but within the realities that we're all facing, which I'm acutely aware of. So I'll start by presenting my slides, but feel free to, I know it's formal, but it's not. So please feel free to raise your hand at any point, interrupt me if something's not clear. I'm happy to explain. And the high level overview of what I'm going to talk about today is, you know, I've done many projects, but one of the most important to me was this work I did with the California Association of Adult Day Services. They had a large grant at one point to conduct a project that I'm going to talk about, and it was an amazing project. They needed somebody to evaluate the results, and I was a hungry postdoctoral fellow at a meeting of the National Adult Day Services Association, and someone plugged me into them. And me and my colleague Lydia at CADS, we're still work closely together, and that was over 10 years ago. So we are like a great example of community partnered research. And the issue that she faced once that grant was, even though it had amazing results based on my evaluation, was that it was completely unsustainable once the money ran out. And so we had to come up with a new way to figure out what was the secret sauce of that program and how do we make it so that we can keep the goodness of that program alive and scalable in programs across the country. And so that's what I'm going to talk to you guys about today. So let me go ahead and share my screen here. And okay. All right. So this is me, and you're welcome to reach out to me at any point after this call. Would love to connect with all of you if I can be a resource in any way. Obviously respite is essential for caregiving and participant well-being. I don't have to tell you this. I have many fancy degrees, but I don't think I learned anything until I dealt with my own father's illness and I sat on the other side of the table and I had a doctor barking orders at me, telling me that I needed to monitor his medication and, go see 7 doctors and then report back on what they all said and keep track of his vitals and do all these things. So caregivers rely on you guys. You are an incredible lifeline for people who are doing unheralded and incredibly important work. And I also know that your programs and the settings that you work in often rely on short-term grant funding. I think, all the day programs I know and all the home and community-based service providers are constantly writing grants, constantly looking for creative sources of funding, but oftentimes it's to really offset the operational costs of running a program that is not fairly or adequately reimbursed. And that's challenging when you're, dealing with staffing issues, audits, oversights, regulations that are ever changing, and, potentially funding cuts or certainly not increases in funding. So that's when it becomes, even if you have the best idea and you're delivering the best program and having the most powerful results, it is very hard to sustain the types of things that you're doing in this environment. And so we have to be cognizant of that. And as I talk to you about my work and how my thinking evolved in this space, I want you to know that it was really with high staff turnover, time constraints, and limited resources in mind. So I mentioned that as a postdoctoral fellow, what feels like many years ago, I was at a National Adult Day Services conference. I'm not the type of researcher who spends as much time as I probably should at fancy, wonky academic science conferences, though I do my fair share of them. But my happiest moments are when I'm engaged with providers who are on the ground, who are doing such important work. And I go in as a listener and try to understand the challenges that they're facing. And so I happen to be very lucky as a postdoctoral fellow to be sitting at a meeting and being told about this community-based health home project, which was created and developed by my colleague Lydia Miscellanies, who got a $2.5 million grant from a private foundation. And what she did was in, I think, about 15 centers across the state of California, 15 adult day centers, she was able to embed an extra registered nurse. Like, what a dream. Already, I can see where your heads are going. Like, who has the money and the time and the patience for an extra registered nurse to sit and do this? But she got this funding because she wanted to turn the adult day center into a medical, sort of like a community-based health home for people who were very high risk and had multiple chronic conditions. But so it wasn't just people who had diabetes and hypertension, and the usual sort of constellation of chronic diseases that we see, but it was those who not only had diabetes and hypertension, but lived alone, had, cognitive impairment that we knew was more severe than anyone had ever diagnosed because they saw them all the time. And they knew that they had no one at home and their fridge was probably empty. And all of these factors were interacting and exacerbating health outcomes. And so they were given the funds to embed a registered nurse navigator who was embedded in the day program, but their job was to actually leave the center and go to people's houses, go to their doctor's appointments. If they ended up in the emergency room, meet them in the ER and say, if, for instance, if they had an individual who had multiple conditions and they had been trying to get in touch with their doctor because their blood pressure was high at the daycare center every week. These nurses would instead go with the patient to the appointment. They would sit at their side and they would talk to this doctor and they would say, listen, doctor, I see this person 3 to 5 days a week. I've noticed that their blood pressure is very high. And I really think that you may want to consider changing their medications. And here's the list of how their blood pressures have been the last couple of weeks. And the outcomes with this program were incredible. So for the first time, and I don't know about your centers in particular, but what we've noticed is that what happened, even though 99% of healthcare takes place in our home and in our communities, and actually most of healthcare doesn't take place in a doctor's office or in a hospital, very little information from the community makes it into the doctor's office. And so these nurses were really amazing at coordinating care across all these different community settings and making sure these people who are very vulnerable and high risk to poor health outcomes, hospitalizations, emergency department visits, nursing home placement, were receiving the full wraparound support that they needed. What made this model so unique, and Lydia was, a person who'd worked in adult day services for, 40 years by that point. She's an incredible policy advocate for advancement in the field and advancement of CBAS programs in the state of California. She really created and developed a model working with her colleagues and experts and thought leaders in the space that was interdisciplinary and person-centered. These nurses received extra training to conduct really comprehensive biopsychosocial assessments, which is what we need to be doing in older adults, because what I love about studying older people is that it's not just one disease in isolation, but there's a whole, context that we have to account for when we work with them. And that's the only way that we deliver better care that improves quality of life. And so they were trained to do these comprehensive assessments. As I said, they were active across settings. So they were in the home, they were in the hospital, they were in the primary care provider's office. I'll never forget one of the key quotes that came out of my evaluation was a woman in a wheelchair. They went to her apartment and they saw that her fridge had been empty. And the nurse said, well, doesn't the social worker give you SNAP benefits? Didn't we get you enrolled? And she said, I'm homebound and I'm in a wheelchair and I get $15 a month. Like, where am I going to go fill my fridge? Who's going to do that for me? And, it was not until they went to the home and they saw that fridge empty that they realized, okay, we need to, start bringing this woman groceries and getting her needs met that way. And what that all served to do, as you can imagine, is that it really provided much earlier intervention. It provided much more comprehensive support to caregivers who were doing all this work with no knowledge or no training and no one to help them quarterback their care team. And it really improved the chronic disease management, all because these community-based providers had such strong knowledge of these individuals and their needs and their families' needs. And they were really well positioned and with this grant, well resourced to deliver comprehensive interdisciplinary person-centered care. So my job was to evaluate them, and I didn't want to really spend too much time on today's webinar, like going through the different results of the program, but we looked at certain key indices over the course of 1 year of CBHH training. And what we found is that with proper support, proper case management, wraparound care, people's depression, the severe cases dropped from 6.2% to just 1.5%. Their self-reported quality of life improved at the highest level. From those reporting high quality of life went from 53 to 62%. We saw improvements in their nutritional risk, the way their pain was managed, and self-perceived reductions in loneliness. We also had strong participant and caregiver testimonials, and overall reductions in hospitalizations and emergency room visits. So, like, what an incredible program, right? And what a way to potentially, if you do a cost analysis, save the government tons of money. Yes, you invested in a nurse, but man, these people are now happier, they're living better, their needs are being met, and they're staying out of hospitals and emergency rooms and nursing homes. It's exactly what we should all want as care providers. But of course, there's things that work in, a sort of, how do I say, an optimized setting. But in reality, there's a lot of cost and scalability challenges. And I know that you all think about this in the back of your mind, right? This grant isn't going to be here forever. And how do we keep making sure we continue to do this work, even in the absence of this funding? And so in our case, the issue was that they never found a way to make the nurse navigators reimbursable, right? It was just going to be an extra sort of part of the lump sum reimbursement to the day program. And then there was also the issue of staffing shortages. Sure, like amazing geriatric trained nurses are hard to find, even if you have the money for them. And there is, of course, significant turnover challenges and lack of continuity. And of course, because it was a research study as well, they required all these, outcome measures to be collected. The data collection was incredibly time consuming and a huge burden on the staff. And to be completely honest with you, and I think if my colleague Lydia was here, she would say, these aren't people who are trained data collectors, and the policy, sort of the protocols in which this was embedded, really didn't account for the realities and day-to-day needs of these individuals when she designed the program. As I said, I only came in as an evaluator when it was finished. And so I think hindsight 2020, there's ways that she would have done this differently. And of course, the biggest change is that a problem is that scaling this model is really cost prohibitive without the structural changes. So, with any work that we do, any innovative finding we have, advocacy is always a must, because we need to get paid for this type of change. So here's the issue. So we have this amazing program. We've had great results that have come out of it. People are incredibly satisfied. And yet we can't keep this program going in that form. There's just no way to do it. And so we could continue to apply for more grants, which Lydia and I did. And the program continued, and we got, different grants for different things. But at the end of the day, what this forced me to do was think bigger, and think more broadly. And so I went back to that data, both the qualitative interviews that I did with, 50 people who, whether they were patients, family members, clients, staff at the Adult Day Center. And then I also looked back at the actual data that all these staff members had put together. And I thought to myself, okay, what was it that made this work? At its core, why was this successful? And one of the primary reasons was that these nurses were communicating and they were coordinating in a way that doesn't otherwise happen in the absence of these programs. And so for the first time, as I said, information was leaving these day programs. I have been to day programs across the country. Many of them, and maybe yours too, have a fax machine, a physical fax machine in the office. And that is how information is relayed. If Mr. Smith's blood pressure has been high, there's a fax that is sent to the doctor's office, and that fax ends up in a black hole, in an abyss, and no one or home and community-based providers will call the provider's office and they will say, I don't know who this is. Please stop talking to me about my patient. There's real problems around communication and care coordination, even if the information exists. And so what these nurses were doing was that they were taking information out of the center. They were gathering information as well from multiple sites of care across the community. and they were giving it to these providers who could then make informed, actionable decisions about the issues that were most relevant to these people's health and that were most impacting their safety and well-being. And hence, once all of that was addressed, all of these other outcome measures that I mentioned earlier, the depression, the nutritional risk, the falls risk, the pain, all of that stuff was much better managed. So I had to say, in the absence of having, an endless amount of money and being able to do this, how could I replicate that model of the nurse in a way that's scalable and affordable that any center, even if they don't have a nurse or a nurse navigator, could do? And so when I looked and I thought about all the other aspects of my life, one thing that immediately came to mind was there's got to be a technology and potentially even an app that could help facilitate communication. I also knew the reality was that I could build an electronic health record system that maybe talked to between a day program and a primary care provider. But the problems with that model are that 92% of adult day programs lack electronic record systems. Electronic record systems cost a fortune, and nobody has ever given home and community-based service providers subsidies to have those, which makes it hard to keep track of information, which could be a struggle that all of you are having, even in doing all of this. And you need something that's affordable, lightweight, portable, that's not only going to achieve better outcomes for participants, but also for the providers who are going to make their life easier and not simply overburden them and add to work that they're already over full plates. So I actually spent some time and received some funding to create a mobile application called CareMobi. And I created really a mobile application that was designed both with and for family caregivers. But it was really designed with the idea that most of healthcare, as I said, happens across these community settings. And those community settings are not linked to one another. So nobody talks to each other. And what I found in my research and in my own personal life is that when there's a problem, when somebody has, serious health issues and they land in the hospital, most of the communication is mediated across these settings by some sort of informal family caregiver who never signed up to do this, and chances are isn't a doctor or nurse, and even if they are, has a very hard time doing all this coordination. And so the nurse navigators were really substituting for that family caregiver. They were augmenting and providing them support, and they were helping do this communication across settings. And so now we said, well, let's create a mobile app that will similarly, like the nurse did, augment support for family caregivers, facilitate communication across all these sites, and give the family caregivers this information so that when they go to the doctor's office, they can be really effective advocates for these people's care, just as those nurses had been doing. And what we can do, what MOBI stands for, is M Health for Organizations to Bolster Interconnectedness. And what that means is that there's all these little community settings where a majorly important care happens, and they're not linked in, and they're not linked together, and they're not linked with families who rely on these programs and the people in these programs to support them. So what we did was we created an app that is really simple to use. We created it using a very user-centered design. We interviewed hundreds of primary care providers, family caregivers, respite providers, adult day centers, and we asked people, what information do you collect on a person's day-to-day health? And then we asked primary care providers, of this information, what information would you need, would actually be useful to you to inform a clinical decision? And, we really did get it down to a science. At the end of the day, there's just a handful of things that doctors need to know about that will really prompt them to, take some more rapid action to address a person's need. And so what we did was we focused on a few key areas, just to name a few: mood, appetite, sleep, medications, and behavior. I'll just tell you a really scary story. This one doctor told me that, he said, oh, medications are the most important thing. Like if somebody could just give me an accurate list of medications, because what happens is the home care providers will send us a list of medications. And he said, when I was a resident, I used to edit that list and try to get it all right. And he goes, now I don't even have the time to do that. So I just sign it and send it back. So there are literally incorrect lists of people's medications being faxed between providers because nobody has the time or energy to sort of look at these, when the reality is that the medications people are taking at home are not even what's listed in their chart, right? There's so many differences between reality, like what is happening and what doctors think is happening, and what is actually taking place and contributing to some of the, adverse outcomes that we see. In fact, if you look at the research, they'll say that about 50% of emergency department visits 80% of emergency department visits are because people don't take their medications correctly. And that's insane. And that's something that we can intervene on, and we're well positioned to support. The number of times somebody shows up to an emergency room, and you've never seen this nurse or this doctor in front of you, and they're like, okay, tell me what medications you're on. Somebody better have an accurate list. And it hopefully is not the list that's being faxed back and forth between people that no one's even checking. So I think this study really exposed to me the harsh realities of what real healthcare really looks like, and what my colleague and community partner in California was desperately trying to fix. And so the app kind of hones in on the key pieces of information that doctors and healthcare providers need about a person's day-to-day health so that they can make better decisions. And as I said, some of the categories in the app are listed here. And I even asked caregivers, I said, how do you currently store all this information? And some people were like, oh, it's all up here. And some people were like, oh, it's in a box under my bed and all these papers. And some said, oh, I'm so organized. I keep all my loved ones' information in Google Docs. And I'm like, okay, well, that's a good way to sell their information. And then the first thing they ask me about my app is it HIPAA secure? And I'm like, yes, mine is, but Google Docs is not. So you should. Families keep information when they're trading information. It's in their text messages and WhatsApp. And when a doctor's like, okay, how has this person been eating and sleeping? No one can answer that basic, simple question. Or, what did the nurse at the day program say? Why did you bring your father here? A great example that's very common, is like an instance of a person living with dementia throwing their diaper. So we've had reports of people who will say, this person comes to the center every day, that the staff really know their like sort of personality and their day-to-day habits. And this day, this person is insisting on being taken to the bathroom 5 times. And they're in the bathroom and they're throwing the diaper and they're very agitated. And, the nurse or whomever, the staff member interrupts the caregiver's day at work or respite period or whatever it is to say, hey, I think your dad has a urinary tract infection and I think you need to get them seen, because they're throwing their diaper and they're very agitated. And so this person now has to give up their precious free time, come pick up this person, call the doctor. The doctor says, I'll see you in 3 days. By the time they get there, now this person is even worse. And the doctor asks the caregiver, well, why did you get sent here? And they'll say, oh, the staff member said he's throwing his diaper. And I keep telling them it's because he has dementia. And it's not. It's because this person has a urinary tract infection. And that's what the staff member was trying to communicate. But it gets lost in communication. And so the app was designed to more clearly secure and share updates with between family caregivers, between adult day programs, between home health aides, whomever is involved in a person's day-to-day care. The app can share updates so that whoever takes this person for their visit can understand what's going on. It's also so that for people like you who are so committed to getting respite for providers, when my mother was caring for my dad, she would not let anybody take care of him because she's like, you don't know his medication schedule. I'm like, people pay me to give medication for a living. And she's like, no. Like, nobody can give his medications the way I can. And you know what? I feel like that was a silly reason for somebody to not get respite care when you could have a place where their medications are listed, where you get a push notification at the time they're due, where you know exactly what medication you have to give and when. This is a very simple way to share this burden of caregiving across people in a way that's safe and secure. And so not only that, it increases trust and transparency and continuity. And so I want to stress that was really our goal here. And I think there was, let me just see. Yes, I agree with that. Yes, throwing the adult brief is a behavior expression. And so it's really important to recognize patterns. And that's what I think is really important about all community-based providers. Like, we see these individuals on the regular, we understand their behaviors, and not always, it takes time to do that. But it's important that we're tracking this somewhere and somehow so that we can explain in our visit with the doctor, which lasts less than 18 minutes, what is going on with this individual. And so we designed a user-centered smartphone application. You guys should check it out. It's completely free. And in the App Store, it's called CareMobi. You can use it to care for someone you love. You can use it to care for keep track of your own healthcare. You can use it to, if you're, in any kind of home and community-based setting, to communicate with your caregivers. I will say that I had kids in daycare, and I would send my kids to daycare and I would get 50 pictures, and I would know how many bottles they had and who was with them and who they played with. And I would have all this information on how their day was. And if you send somebody to an adult day facility, it's very unlikely that you're getting that information. And it shouldn't be like that. Because arguably some of these older adults are extremely vulnerable and we need to do a better job. So CareMobi was, as I said, it's an app that we created. It was to solve this problem that we were trying to solve with the nurse navigator, but realizing that we can't sustain that past the grant period. So what could we learn and how could we progress and innovate? And it allows people to share information, as I said, with anyone that's on their care team. So whether it's a family member, a home health aide, neighbor, et cetera. And so we use this app to track and set medication reminders. We can log and view trends on how their mood is, their sleep, their nutrition, what they're, do they eat half their meal, all their meal? Doctors don't need like an exact, count of how many calories they've had, but they need to generally know what their patterns are. So I'll give you a brief overview
Welcome
here.
to CareMobi, the app designed to help families manage the health and wellness of their loved ones with ease and collaboration. Imagine you have an older mother whose medications, diet, and overall day-to-day health needs to be monitored closely. CareMobi simplifies caregiving by enabling you, your family, and anyone else involved in your loved one's day-to-day healthcare to collaboratively manage and stay up to date on their care. Keeping track of medications is critical to good health. In CareMobi, you can create and maintain an up-to-date list of medications with dosages, receive reminders via push notifications, and take them at their scheduled times, as well as track whether or not they were taken. The app also provides secure storage for important documents, whether it's lab results, medical records, or insurance cards. In CareMobi, you can share day-to-day updates through photos and videos to capture how a person is feeling, celebrate positive progress, and document changes in functional capacity. You can add comments to a post and mark it as seen, which enables communication around different issues from multiple team members. By turning on push notifications, you will never miss important alerts when there have been updates from other team members. A convenient search button allows you to find and hone in on all the information you need within the app. CareMobi allows families to keep track of all the moving parts of a person's health.
So we have since pilot tested this in a couple of center day programs across the country. We also have about 4,000 regular, ordinary family caregivers who've downloaded the app in the App Store and have completed surveys for us. And I will just share with you, that caregivers say that I could give his doctors the information that I know is happening during the day. They said that it's the ability to share information with their family members, being able to see the behavior for the day. But there's a lot of information here about how, people feeling like others need to be part and more engaged in the caregiving process, even if they might not be in the exact same place or they might not be with this person all the time. It's much more helpful if everybody's on the same page in terms of getting support and achieving better caregiver supports, which I know we're all on the same page about. So if we have time, let me just see how we're doing on time. I will show you this, a great video of two people who've successfully used this tool. But what I want to make sure that I get at is that what we saw with this is that it is hard to sustain these things, but at the same time, the families and the people that we care for, they need better care. They need supports. And it's on us, I think, to help them source them. We don't always necessarily have to reinvent the wheel and come up with, everyone's like, oh, are you using fancy AI? Are you using this? And I say, I'm just trying to get people to stop using a Post-it note and start, keeping everything in one place. It's sometimes we don't have to aim so high. And so I think the important thing is that I wish the one thing I could have said is that I thought about this earlier, that I wish I could have, brought this tool to those families who were in those programs and benefiting from that registered nurse earlier, because I think it would have meant a lot to them. But I think their experiences have also helped a lot of other caregivers as we've tried to figure out solutions. So just bear with me. I'm going to share my screen. Okay, one second. Here we go. Okay, have a look.
Oh, they're waiting on you at the door, Dad.
Every weekday, Jamie Wyatt drops her 88-year-old father, Lewis, off at an adult daycare center.
I get him up and we get going out the door.
Lewis Wyatt was diagnosed with dementia 3 years ago, just a couple years after her daughter had left for college.
I'm thankful that I emptied the nest, so to speak, and so I was able to put my attention on him.
Wyatt, though, works full-time and can't always be with her dad to monitor his health.
What'd you say? I said, I'm just going to keep on living.
I'm one person, no sisters or brothers, very few family. And so, yeah, it was a lot.
Through his adult daycare, the Out Center, she learned about a new tool, an app called CareMobi, and agreed to test it out.
Finding resources that would support me being able to continue to live my life, have my career, was very important to me.
Often people with dementia don't effectively communicate changes in their symptoms.
In addition, you can track other vital signs, nutrition, sleep.
Nurse practitioner Tina Sadrangani created CareMobi to help caregivers collect and manage all the information they need to provide the best care for their loved ones.
Sometimes they're just a little more confused. Sometimes they fall. Sometimes they're just not eating as much.
Sadrangani worked with caregivers, nurses, doctors, and programmers to create an app that gleans the most useful information for a person's care team to help connect the dots.
It can actually be a telltale sign that there's something brewing: pneumonia, urinary tract infections, and things that are highly treatable if caught early, but often are not and lead to avoidable hospitalizations and emergency department visits.
It's a small but potentially powerful tool that Sadrangani hopes will offer a growing number of middle-aged Americans a much-needed hand.
There are 53 million caregivers in this country providing this care to aging loved ones every single day in America. Yes, many of them are like me, who have young children and aging parents, who work, who have other responsibilities. And the stress and the load associated with that is incredibly powerful.
Wyatt's Father's Daycare Center is one of several senior facilities taking part in a study funded by the National Institutes of Health to test the effectiveness of the app. So far, Wyatt says she's been able to show up with her father to doctor's appointments better informed.
I most appreciate that because they're now spending more time with him than I am in waking hours. When I do go to the doctor and they're asking questions, I can go in there and show them kind of what's going on during the day.
For now, while it's in beta testing phase, CareMobi is free.
Within 3 weeks, with absolutely no marketing, no news show, nothing, we had 400 people using it, actively using it, entering data.
Which speaks, she says, to the growing need.
But yet, this trend is not going away.
Sadrangani says she hopes the app becomes a part of a larger movement to better support aging baby boomers and the people who care for them.
The caregiving crisis in this country is that it is a team effort. It needs to be part of a broader infrastructure. It takes a village, it takes a team, it takes a community.
Erin Billups, Spectrum News.
So I think what I want to get to is really, how do we think about how this works? And how do we come up with innovation? So again, we know that these are settings where 92% lack an interoperable electronic record system. People are using paper, fax, and voicemail. And we intentionally are thinking now, because we've had so many learnings, that we need to develop solutions that are innovative, but also easy to use, don't require a ton of infrastructure, which, you're not going to have anytime soon at the way things are going, and really create minimal staff burden, but also provide immediate value. And so with our testing so far, I think because of all the learnings over time, we've gotten to a lot of very high levels of caregiver engagement and satisfaction, better communications between doctors and care team members. But what we've also seen is increased retention at the adult day centers that are using these. So people stay there longer because they don't end up in the hospital or in the nursing home. And we have much more visibility into people's needs so that we can better meet them. And I think we've had to think about paths to sustainability too. And I just want to say that everything that we do as far as programs, like we all need to have a policy component and an advocacy component into the work that we do, and really being able to tell our story, showcase the evidence of what we're doing and why it works with data, and build policy support for the programs that we have. And we also need to, my colleague in in Tennessee, who was at the center that you just saw the video of, he'll always say, you just say yes. Like we have to say yes. We have to stop really thinking about all the barriers that are getting in our way, and start thinking innovatively about how to get around them and embracing some of this change and streamlining some of our operations. Many of the centers I work with were very reticent to adopt this. One of them had a nurse that was 82 years old, and she's like, I've been doing this the exact same way for my career. I'm not changing this now. And that's a difficult attitude and personality to change. That's not how successful models and programs live on. But I think once you have buy-in, once you can speak and showcase the power and potential of these, and once you see that families need these and eventually will be wanting these types of things, we have to be ahead of that curve. And really, we understand the needs of family members in this position, I think, better than anybody out there. And so as we develop programs, and think about their sustainability, we really, really need to make sure that we're being responsive, we're being creative, we're being low cost, we're being scalable, but we're being responsive to their needs. And so I think as you think about, the work that you do, yes, maybe you don't have to adopt technology. Maybe technology feels like it's more work. Maybe, the next program feels like it's not, or it needs staff, or it needs this. I think we need to start thinking about designing solutions for affordability and adaptability. How can we do what we want to do in a more effective and modernized way? And I just want to really emphasize that, and I don't think this is emphasized enough, those of us who work in research institutions are ready, willing, and able to support all of you in this work. There is no community setting that is too small. There is no community setting that is too different. There's nothing we haven't seen before. We understand that every setting has a different workflow. If you've seen one day program, as I like to say, you've seen one day program, right? They're all different. It is so important, particularly home and community-based providers, to engage researchers as partners, and to collaborate early and often. Some of the challenges that you face in sustaining and measuring these programs and telling your stories and pulling the data to advocate to people for your needs, I get it. You don't have time to do that because you're just trying to keep your the roof on top of your center, right? Or your operations running. But we exist. We are there to help you. And part of what I was able to do with my colleague Lydia was solicit this additional funding from a research site that both she benefited from and her centers benefited from. And we're able to bring back, these dollars to continue advancing these programs, but also studying them and finding ways to make the work that you're doing more replicable. We're also well versed in the administrative challenges of managing a grant, which I'm sure, is very hard. It's hard for me too. And it's the receipts and all these other things that you need to constantly have, and keeping track of these expenditures and thinking about how am I going to, bring this innovative program I've developed, but also keep my day-to-day operations running. And so I think because we're experts in implementation and we've been to so many centers, and we can take this sort of take a few steps back and look at the situation and collaborate early and often. Again, no good researcher is going to tell you what to do, but we're going to work with you to understand what challenges and opportunities exist and come up with really innovative and potentially creative ways to address some of these issues and create programs that not just are impactful, which is what I think you're doing, but scalable and sustainable. So I wanted to make sure that we left some time for discussion and questions, but, you're most welcome to reach out to me. I'm very engaged with other community providers and research. As I said, I don't create tools or solutions for people, but with them. And really, really happy to see all the good work that all of you are doing in this space. It's much needed. I think we all share tremendous desire to advocate on behalf of caregivers. The other thing I will just tell you is that, what I've learned from my work is that you can hand people an app, but they have to know what to do with it and they have to know what information to put in it. And so we created a social media platform that's available on Instagram and Facebook called Enlightened Caregiver, which you'll see over there at the top. And we provide a lot of information about, everything from how to talk so your aging parents will listen, how, to questions you should ask at the end of every doctor's appointment, and what to look, signs that your loved one needs more help, et cetera, but really useful information for caregivers who are dealing with the day-to-day challenges of understanding how to care for somebody. So I encourage you to take a look at that resource as well. But I'm happy to, engage in conversation and questions and, learn also about what all of you are doing and some or any of the challenges that you might be facing in your work. I know the Zoom webinar format is always so challenging. Go, Carrie, are you coming off of mute, I hope?
Yes, this is Carrie Jordan, and I have a question. Does the app cost anything?
No.
It does not cost anything.
It does not cost anything. So it's free. And it is in its current format it's currently available for whether you have an Apple or an Android device, doesn't matter, a tablet. It's currently freely available in the App Store. So you can go download it and see what it's all about.
Yeah, cool. And you said you could share with family members. So the family member would get the app, you'd get the app, and you'd both be able to see the content of it.
Exactly. So what happens is that, for instance, let's say my mother is a client in an adult daycare center. So I would download the app as her family caregiver, and I would create a care team for my mother. And that care team has all the information about her day-to-day care. And I would invite you, Carrie, let's say you worked at the adult day center, to be on the care team as well. And you could add updates about what happens at the center. I would also invite my sister, so she's in the loop as well, and I'm not the only one dealing with this. And I would invite the home health aide. And then as a caregiver, I control who's on there. So if she stops going to your day center, you're no longer involved in your care, I can kick you off the team because and you can only see the information of somebody whose care team that you're on. So for instance, if you have sorry for keep using this example, but if you have a day program and you have 20, clients who are on this app, the clients obviously can't see each other's care teams, and you can see all your individual clients' care teams, and their families can see, the care team that they're associated with. Great question.
I just want to say I think it's a great app. I mean, this is what I've heard about it. So I'm very interested in looking it up and seeing, the care coordination piece is really huge, and it could be a big help. Could see that.
And the thing that I want to emphasize too is that there was a lot of hurdles I had to overcome to get people to use this, right? Because everybody's first reaction is, no, I can't do anything extra. Nobody is paying me to do anything extra. And I don't have enough staff, and I can barely deal with my staff, and I'm too busy doing 5 other things. And I had to have them take a step back. And I said, I know that you want to do what's best for your families. That's your job. And nobody I know cares more deeply than the people like you on this call who I interface with. And if you knew that there was a tool that's freely available for your families to use that would help them deliver better care, why wouldn't you bring that to their attention and give them access to that? Oh, because we can't come up with ways to work around these situations. So fortunately, I had a couple of centers who said yes to me immediately because they really understood the problem that this was causing. And guess what our learnings have been in this feasibility study? Number one, they thought this was going to be double documentation, so much time. They have saved so much time by using this app. They are no longer calling people, trying to hunt them down to tell them their father had a loose bowel movement. right? Like they'll get actual communication back from the caregiver who might not come home from work till 9 o'clock and remember, oh, shoot, dad has a neurologist appointment tomorrow. He's not coming, or you're not going to see him. And then they learn, oh, he has a neurologist appointment. Make sure you ask about X, Y, and Z at the appointment. And there's actual like communication that's happening, and they're saving time. They're, better using resources, and, they are, it's been really successful as far as there's time saving interactions. Their clients are also happier. So one of the other things that we've seen is that families really struggle, like my mother did, quite frankly, trusting other people, even people in their own family, to deliver the care, right? So many of these caregivers who are working so hard are like, oh my God, I'm dumping my loved one by putting them in your beautiful respite program. You're not dumping them. You're trying to give them, like, get the support that you need. And if you're supported, they'll be better supported, right? We all know that, but people don't. And once they start to see and have a lens into what is happening, and they see that their father, who at home is slumped over in a chair watching TV, and at the center is doing his conga line and dancing, they're like, oh, you know what? I'm going to spend the 2 hours in the morning getting him ready to go there because I see the meaning it's adding to his day. And that means centers don't lose clients, right? So we have to stop at that roadblock of, oh my God, this is extra staff, this is extra work, this is never going to work. Of course it's going to work. If you say yes and you put in the work, it will work. But we have to understand that, like, I think we have to think innovatively about what this could do and how this could support us. And that's on the side of the provider, but I think on those of us who are trying to design these programs, we also have to think innovatively and say, okay, I know you're not going to spend $1 million on an interoperable electronic health record system. Like, that's not feasible for you. So what else can we design to achieve this? And if the standalone daycare can do it for the kids, why can't we achieve that same care for older people? So, I think and so I know there's a question in the chat about, so how is the app funded? And that's a great question. So when we designed it as initially a research study, again, we applied for a grant, and we did the development and the testing with a grant. And now we're working towards finding a sustainable model to keep it to keep it available. And what we found is that so it currently lives for free in the App Store. And one of my commitments was that, I think family caregivers do so much, right? I think they do so much, and that they shouldn't have to pay for a tool like this. But one of the thoughts was that some of the larger agencies that are interested in using this, so you guys might be familiar with, like, for instance, the PPL program, where you can pay a caregiver to, they're called different things in different states, but where you can pay, essentially a family member can get paid to be your caregiver, right? So the administrators of those programs are really interested in this, because if caregivers are keeping better track, outcomes are better, and they realize that they're paying these people, but there's no, like, clarity on what's happening and coordination, et cetera. And so, we found that if we can create a web-based version of this that they could use on their desktop, there's like a customer, there's like a reimbursable model available for that, where they would pay per user that they have. And so we've actually found,
thanks.
We've actually found, a reimbursable, paid model, where we could keep it for free for most people. But for larger agencies who would have, tens of thousands of people potentially using this, we could create a paid version that they would subsidize, and then we could keep this going. But again, it would be very hard for me to do that if I created Epic. Right? Like, I would need, but an app like this is not, it's not cheap. I've had to, like, get grant funding to get it going. But I've had to think about, and I've actually, just so you know, as a researcher, spent a lot of time in incubators and at accelerators, and learning from the private sector about how we make things sustainable beyond a grant period. And that wasn't really part of my presentation, but it is an incredibly important thing for all of us to learn. Catherine.
Hi there. Thank you so much, Tina.
Yeah,
I'm a huge fan.
I know Catherine's my, but I love Catherine so much.
Huge fan. So Are any of the centers that you're working with or have worked with, do they have existing systems like Story Care, like I know there's other, we use Story Care. So
Yeah.
have you seen, like, is there a way that people can upload notes or a profile from one to another?
Yeah, so I think the question is like, are they interoperable with StoryCare,
Yes.
Botar, like some of these others? So we love all of
Okay.
our vendors in the system, and we are actually going to work with one of them to try to see if there's some potential for interoperability here. But the answer to your question is that it isn't interoperable with any particular like billing software or system, and I think there's a reason for that, which is really that we don't want this to be another chart. We don't want this to be another thing. We want caregivers to feel empowered when they sit in front of a doctor and have the information at their fingertips. We just know that clinicians, what they've told us in our research is like, they don't want to look at another thing in another bloated chart that's, and so it's really important. And what you can do in CareMobi is you can export, there's an export summary feature. So if your doctor's like, I just want to know how his blood pressure's been and how he's eaten in the last 3 months, it can quickly summarize that data and print out a report or send it as a PDF, and that they can append to the chart as well. And so you can say, oh, he's eaten half his meal most of the time or less than half. And then they're like, okay, this is something we need to do here. So, but yes, we're working with our partners, but we're very careful because we don't want this to be another thing that gets dumped in the chart that no one sees. And I know, Isabel, we're approaching time, so I know all of you guys are incredibly busy. So if there are other questions, I'm happy to take them. And like I said, you should please feel free to reach out to me anytime. I'm happy to talk to all of you about the different things you're doing. So excited to hear about your programs, and think about ways to make them sustainable.
Thank you so much, Tina. Thank you for your time, for your presentation. Everyone on the call will receive the PowerPoint presentation as well, so that will have Tina's contact information. So please feel free to reach out to her on a one-to-one basis as needed. So thank you again. If anyone needs anything, you all know where to find me as well. But I hope you have a wonderful rest of your day.
Thank you.